Good afternoon and welcome everybody to today's event. I'll just do a quick sound check. We're waiting for some more people to join. Now I think everyone on the call, the attendees have been muted, but if you could, somebody just give me a quick reaction, a thumbs up, just then we can check that you can all hear us. Perfect. Thank you. Well, it is 4:01, so we will kick off. Again, really warm welcome to today's event. We are marking and celebrating the International Day of Women in Building Science, which celebrates scientific excellence, leadership and impact, and also how we reflect on our systems and how they support talent and diversity. I will start by acknowledging the traditional owners of the land in which I'm speaking to you today. That's the Wurundjeri people of the Kulin Nation, but I also acknowledge the traditional owners of the lands on which all of you are dialing in from today, wherever that may be. My name is Brad. I'm from the Victorian Institute of Forensic Medicine. I'll be your host and chair today. My role should be quite simple, which is keep the conversation moving, allow different perspectives, and let the experts on this panel do the talking. There is a tiny bit of housekeeping, but to keep it flowing, I'm just going to ask Fiona, who's helping me out, to pop that into the chat. The chat is open. We also have today in the background a Cash from IT, just making sure the tech's all working. Thank you both for your help. So, on with the show. I'd love to start by welcoming the panel. Good afternoon to, as I can see them, to Joe, Belinda and Beck. Welcome. And to start off with, why don't you tell everyone who you are, who you work for, and maybe a bit of background about the sort of sciences that are practiced at the institutes where you work. Over to you.
I can start. I'm Professor Belinda Gabbe. I work at the School of Public Health and Preventive Medicine at Monash University. Monash University has a long-standing tradition of excellence in education and research across all STEM faculties. And I'm based in the Faculty of Medicine, Nursing and Health Sciences. I run a research unit in pre-hospital emergency and trauma, and my focus of my research really is around designing trauma systems and trauma care to result in better outcomes for trauma patients. But the school is really diverse itself, and the faculty obviously is quite diverse, but even within the school we have research units across, that are based across occupational health, across all of the a lot of clinical disciplines, intensive care. We have clinical trials, cohort studies, we have genomic studies, we have the whole shebang. It's an incredibly exciting place to work.
Sounds amazing. Beck?
Yes, happy to go next. I'm Dr. Rebecca Kogios. I'm the Executive Director of the Victoria Police Forensic Services Department. I'll start by saying I'm delighted to be here and really pleased to have been asked. It's lovely to partner with the Victorian Institute of Forensic Medicine, with you, Joe, and with you, Belinda. So the Victoria Police Forensic Services Department, we play a really vital role in the delivery of justice in the state of Victoria in Australia. And our aim is really the provision of excellent and innovative quality forensic services to keep our communities safe. We're a very large lab. We're about 500 strong, and we have a model that's fairly unique, in fact, in Australia and indeed in the world. And we think of it as a crime scene to court model. And that really enables high quality value for money services. And we work across some 20 odd different forensic disciplines, all the way from the more traditional crime scene, fingerprints, ballistics, through to lab-based DNA analysis, drug analysis, and some of our more emerging forensic disciplines in the digital forensic space. So very, very lucky to have this large integrated lab. Our workforce, we've got police members working side by side with forensic scientists and other civilian support staff. And we run a sort of a dual model. We have an investigative stream that is really about providing quick leads to police, and that's around prevention of crime, apprehension of offenders, and disrupting criminal activity. And then, of course, we have our evidential services, which is providing that full holistic case response to the court. And that's all about the proper administration of justice. And we have a good, strong relationship with VIFM, who are our co-providers to the criminal justice system of Victoria.
Super.
Right,
Jo?
and lucky last me, but I am absolutely thrilled to be here with these two amazing professionals tonight. My name's Joanna Glengarry. I'm a adjunct associate professor with Monash, but I'm also a medical doctor, a forensic pathologist, and I'm the head of forensic pathology here at the Victorian Institute of Forensic Medicine, or VIFM. So VIFM itself is an institute that provides the justice system with evidence to help underpin safe convictions or appropriate acquittals, and we have teams of doctors, nurses, and scientists, and we focus around investigating deaths that are reported to the state coroner. We have forensic medical doctors who examine offenders and medically assess and support the victims of crime. So we're really focused on not just medicine, but also the community and the courts. And we're all about providing independent medical and scientific expertise. So as you can imagine, we have a range of sciences here. We've got doctors, we have forensic toxicologists, we have a molecular biology lab, we have a histology lab, which is looking at tissues under the microscope. We have anthropologists, we have entomologists, we have odontologists, we have all the ologists you can possibly want. We have clinical photography, we have tissue scientists who work with the Donor Tissue Bank of Victoria, and we have an amazing team of nurses. So we are lucky to have a huge range of sciences represented.
Amazing. I'm equally in awe at being here with the three of you, as I'm sure people who are watching and listening are as well. I'm glad you pointed out what VIFM was, because we assume people know, but obviously Victorian Institute of Forensic Medicine. Interestingly, you all have esteemed professional titles, but one thing I have got used to is, of course, calling people by their first name rather than professor or doctor or associate. So I hope you don't mind. But that's, I guess that's part of how we work every day. Now, the three, it's not by chance that we've invited Monash, Victoria Police, and VIFM together, because your roles and maybe your organisations do intersect some more than others. Maybe can we just touch on perhaps how they do? I think we might find that quite interesting.
Yeah, I'm happy to start. So Monash University, in the School of Public Health and Preventive Medicine, we actually have the Department for Forensic Medicine, which is a long-standing partnership with VIFM and with forensics here. And we really are the Department for Forensic Medicine, and across the university we have outstanding research partnerships with VIFM, and they extend across many of a number of the faculties and other centres across the university, such as the Accident Research Centre. I've worked really closely with VIFM and with the Department for Forensic Medicine on a number of projects. I actually sit on the Ethics Committee and the Research Advisory Committee for VIFM, and it's been one of the most interesting, and it's been a real highlight actually of my career, because it does connect the dots, and it's got such variability in what is done in the institute, and that really feeds through into really outstanding research. We also do a lot of work with VicPol too across the university, and at the moment, we have projects ourselves which are really around large-scale linkage projects with Victoria Police data, trauma registry data, ambulance data, Transport Accident Commission data and the like, to better understand road crashes, prevention and the development of better transport and trauma system models.
And from my perspective, a number of our staff, our scientific staff at Victoria Police Forensic Services, they do lecture into some of those courses that are offered through Monash University. But perhaps our closest, at least our closest operational relationships would be through with VIFM, the Victorian Institute of Forensic Medicine. We're co-providers. I think I might have said that before, but if you think about the provision of forensic science and forensic medicine services to the criminal justice system of Victoria, it's pretty much us and VIFM co-providing into that space. And I think what I've enjoyed throughout my career, and I did start as I know we'll touch on that later, but I did start as a practitioner before coming into leadership. We do have some really good relationships at the practitioner level between the Victoria Police Forensic Services Department and VIFM. I can think of many occasions myself where I'd be in the field at a crime scene working alongside some of your forensic pathologists. David Rance and I always seem to be at crime scenes with David. We must have been rostered on the same shifts. Particularly areas of our department, like our disaster victim identification unit, work really closely with the pathologists at VIFM. Our biologists work very closely with the mortuary staff. We're often the recipients of the samples that are being collected by the the pathologists and the forensic medical examiners over at VIFM. So those connections at a practitioner level are really, really important. And at the executive level as well, we enjoy some really strong relationships between our department and the institute. We're always looking for ways to collaborate and strengthen that bond.
Yeah, and again, VIFM definitely part of that really key triad where we've got great strong links with Monash. I sit on the same research advisory committee with Belinda, and it really is a multidisciplinary approach to research. All of the departments across VIFM are getting involved in research, but we absolutely rely on the skills and the expertise of our Monash colleagues to make sure we're doing that right, because there's no use doing that research if it's bad research. And that ability to work together to get good outcomes from the data that we generate at VIFM, to then help the community, to help the police, to help provide evidence for what we're doing is absolutely invaluable. And again, yes, we deal closely day to day with the Victoria Police. So both us as forensic pathologists at the scene, and look, I think over the years, probably everyone's been at a crime scene with David Ranson. We deal together really closely from crime scene through to performing the examination of those who have died. And that's me as the doctor, but also our expert forensic technical officers bring their science and their expertise to it. And then with regards to all the testing, and as you've said, that day-to-day executive and operational strategic level as well.
Excellent, thank you. So we've got the three right organisations, definitely three right people in the room. Thanks for the introduction, thanks for explaining how you fit together with your various roles. Thank you for giving your time up today. Now we get into it. The session is called From Lab to Leadership. So we want to really go back to the beginnings, and you touched on it a little bit already and about the science, but what we'll do through the course of the next 45 minutes or so is start from the lab, and then we'll finish with your current roles today and what that looks like from a leadership perspective. So let's begin with the science. If you go back to your beginnings, maybe each of us could take us through your journey and your experience as a young person with an interest in science. Start there, tell us about that, your experience, and don't forget to tell us what your original science is. Let's start with, we'll keep rotating it, let's start with Jo.
So my science for me is medicine, specifically forensic pathology. But if I go way back to what attracted me to this, I'm ashamed to say it was as a bright-eyed and bushy-tailed little teenager reading Patricia Cornwell novels where the forensic pathologist was so clever and she solved all the crimes and saved the world, and it was just magic. Having gone back and read them now, they're absolutely dire from some working in the field. I can't do it. I think the one where she went up to the space station to do the autopsy, I drew the line at that one. But what I guess I really liked was the problem solving aspect. And I was one of those kids who always wanted to know how things worked. And forensic pathology is the ultimate in how things work. So pathology itself is a specialty within medicine that deals with disease, its diagnosis, how you diagnose it, how disease is caused. And forensic pathology is a subspecialty within that looks at the cause of death and examining those who have died, and in particular our interface with the courts, the forensic side of it, which just means how things interact with the courts or the legal system, is looking at how people have died, reconstructing the circumstances of how they've died, diagnosing injuries, and the effects of those injuries. So for me, this is the ultimate in how the human body works. And Mum and Dad bought me a book on how the human body works as a kid, which just blew my mind. That and dinosaurs, to be fair. But I think everyone gets blown by dinosaurs when they're a kid. It's a great field. But in terms of then doing it, I just loved dealing with doctors. I had dealings with doctors as a kid, and they just seemed to be kind and smart, wise, and they could do stuff that made you better. So that's what drew me in.
Excellent. Beck?
Yeah, well, for me, my PhD was in actually breast cancer research, but with a focus on molecular biology. And then my forensic expertise was in DNA and blood pattern analysis. I think looking back to my childhood, my parents say that I, at the age of 5, went from wanting to be a fairy to wanting to be a forensic scientist. And I often think about how did I even know what that was at that age? Well, my dad's a scientist, so we would talk about science quite a lot. I think it's fair to say he was a key inspiration for me in the early days. And I loved reading. I loved books, and my favorite books were Nancy Drew. I don't know if you know of Nancy Drew, but she was Girl Detective was the tagline. So I thought that was really interesting to me. I loved the TV show Quincy, so more the forensic pathology than the medicine side. But I got to thinking, oh, what is this thing, forensics, and how it links to this world of sort of detective work that's interesting to me. And I loved Rumpole of the Bailey as well. So I guess the idea of some career that sat at the intersection of sort of detective work, criminology, science, and legal work, that was just too good to be true for me. And I can remember my dad, he worked at the University of Nottingham in England, and he brought home one day a pamphlet on forensic science. That I think there was a forensic lab sort of operating nearby, and they must have had an open day. And I took one look at that and was just absolutely hooked. So I just always knew what I wanted to do, and consider myself pretty lucky because there are people who come into forensics, get a taste of it, and realize it's actually not at all like what you see on CSI, and leave the profession. So I think for me, having set my sights on it very, very early on, it would have been very destabilizing had I got there and realized it wasn't for me. But no, it absolutely was. And again, very fortunate to be born into a family that not only valued education, valued science, but also didn't see gender as a barrier. So I'm one of 4, 2 girls, 2 boys. And my experience of growing up in that family was your gender didn't have an impact at all. My parents had, the same ambitions for all 4 of their children, which was around what's your passion, and realizing your potential and finding a career that aligned to your passion, no matter what it was. So my sister's a medic and I'm a scientist, and one of my brothers is an artist. So that we weren't constrained in that way at all. And I think that was a big part of what led me, really what set me up for success in a career that I really settled on very early on.
Amazing. Now, Belinda, you've been set up with fairies and dinosaurs. How can you top that?
Well, honestly, I think we all read the same books.
Yes.
So I did grow up on the Nancy Drews and the Hardy Boys and a lot of those sort of books. And I had a fascination. I had a fascination in science right from a young age, and I had extremely fantastic female role models in my family, but particularly my paternal grandmother, who was an unusual woman, very strong. She was widowed at quite a young age. My grandfather was quite a lot older than her. She was a midwife, actually delivered me as a child. So, but she was a huge supporter of mine and really encouraged my love of science. And I was first in family to go to university. So it was something that hadn't been done in my family before. And I found that my grandmother was probably, she was really the one that sort of really got me on the right journey. She bought me all the right books, the books about how the body works, all these, she was a massive op shopper. So the things that she would find at op shops were just outrageous. And I've still got many of them, and they would be these incredible books that were really around all these textbooks and, mathematics and particularly mathematics and particularly science. And she was Gert. She was the original greenie. She lived down at Phillip Island. She was pretty much the only permanent resident in her neighbourhood back then in the 70s. And she was, she really, really sort of got me on the right path. I actually trained as a physiotherapist, so I've had a slightly different background. I was fascinated with how people move. A little like Jo, I had a really great experience with a physiotherapist in my teens. And I really was impressed by, what they could do and how they could really help people. And so that was sort of what really led me into, and my science background was a really natural fit for that. I was in the first intake of physiotherapists at the University of Melbourne. So we had the joy of doing all the physio subjects and all of the medical subjects in first year, Jeff. So my semester of neuroscience and my 6 lectures on the eyeball really stuck with me as completely and utterly useless, but fascinating nonetheless. So I've had and then as a physiotherapist, I had the opportunity to get involved in a research project at the clinics that I was working in, and that was it for me. I was hooked on research. And then degrees in masters in a research masters, and then a PhD followed in epidemiology, and I've got degrees in a masters in biostatistics as well. So that's really how it all came about.
Super. Actually, thanks for sharing your education background. I think with the amount of students on the call, it might be interesting. So yours was all at the University of Melbourne, Belinda, is that right?
I did my undergraduate at the University of Melbourne and my PhD, but my biostatistics, I've got 2 biostatistics degrees there from Monash University and a research master's from Deakin. So, yeah. And I also am a qualified yoga teacher, but I don't think that really counts in the...
No, probably. Are there any letters? Are there any letters under your name for that one? Why don't we actually? Because I noticed we have 3 different accents on the call. So maybe just going back to Joanna Beck actually. And where did you study, and kind of the length of study? Perhaps you did. That might be interesting.
So I started in New Zealand. Born and bred, went to the University of Otago for medical school because that's where my dad went to university, and there were only 2 medical schools in New Zealand. And I didn't want to go to Auckland because that was the big smoke, and much like many big cities, everyone doesn't like the big city who's not from there. And it was a great university where, what could go wrong? You've got university age students from all around the country who go to a small town in the South Island or a small city in the South Island and all live in one big suburb at the other end of the country from their parents. What could go wrong in the days before social media and phones with cameras? So I went to University of Otago, and medicine when I did it was a 6-year degree, and it was undergraduate. So the first year, everyone who wanted to get into physio, dental, pharmacy, medicine, all did the same 8 or 9 subjects, and then it was purely competing on marks to get in. And then in year 2, you, if you were successful in your course, you started there. And for me, that was medicine. I did my first 3 years in Dunedin, and then for the final 3 years moved up to Wellington Hospital because it was a little bit closer to home. Then there you graduate, you start working in the hospital systems, and you do generally a couple of years as a very junior doctor. And I worked in a place called Hawke's Bay, which is on the east coast of the North Island, because that's where home is. And it was lovely to be able to go back and work at the hospital where I had stayed as a child. And I remember going in to do a pediatric rotation, and the pediatrician who'd been there at my premature delivery, some 24, 25 years earlier, was still working at the hospital, and gave a great sigh when he realised people he had delivered were now coming back to work as junior doctors for him. And the ophthalmologist, who was one of my great role models growing up, actually came through there and passed away in the hospital. So it really was a coming full circle. And from there, I went up to Auckland, did my pathology training after dabbling for a few years in surgery, sitting some surgical exams and deciding it wasn't quite for me. Did anatomical pathology, which is a 5-year specialist training program. But during that, I got exposed to forensic pathology. And from there, I never looked back. I absolutely loved it. It was the best of surgery and pathology for me. And then that was another 2 years to then specialise in forensic pathology. And I've been working full-time ever since, and been in Melbourne full-time since 2017.
Brilliant. Thanks for sharing. How about you, Beck?
Well, I'm very envious of your university experience, Joe, because I grew up, as you can probably tell, in the UK, in England, in Nottingham, where everybody goes away to university. I mean, I think there are so many universities, so many towns, so many university towns. So I always had that expectation that that's what I would be doing. And when my parents announced that we were emigrating to Australia when I was 15, and I found out that people didn't do that, that wasn't the norm in Australia, I was absolutely horrified. I remember telling my parents, well, I'll come for a couple of years, but I'm coming back to England to go to university. Of course, by the time I got to university age, I'd realised just how expensive it was going to be, and I ended up living at home throughout my undergrad years. And I did my science degree at Melbourne University. So that was a 3-year undergraduate program. And then I stayed on for an honours year in biochemistry in the biochemistry department there at Melbourne University. After that, I started my PhD straight away and finally got to move out. And I had a wonderful experience in share housing, moving through Fitzroy, Brunswick, with other PhD students, also at the University of Melbourne. Those I look back, and those were fantastic days. So that was through the Department of Medicine at Melbourne University. And then I started in forensics at Victoria Police. And after I'd been to court a couple of times, I thought, you know what, I love going to court. I love the cut and thrust of the courtroom, but I feel like I'm involved in a game of chess, but no one's told me what the rules are. I want to go and do a law degree. So I went and did a law degree, and I did it at La Trobe University, which is just over the back fence from the forensic lab, from the forensic sciences department. So it worked out really well for me. I could just sort of zip over and go to lectures as we used to do back then, before the days of joining online. And I did my law degree, and always thought at some point maybe I'll go off and go down the barrister path. But I've just never done it because I love what I do so much. Probably getting too old to go down that path now, but yeah. And I did go back and, sorry, I'll just say I did go back to the UK eventually, and I did do some work in the private sector in a forensic science lab in the UK in my 30s. But yeah, that's my academic journey.
Well, we may well come back to that at some point, actually, Beck. Awesome. There's a stat, actually, just talk about university experience. And it feels like you could feel sort of the joy, you could see it in your faces as you were talking about it. So it sounded like you had really good experiences. But one of the stats coming out about International Day of Women and Girls in Science is, even though young women are more likely than young men to go to uni, there's only about, I think the figure's about 35% of science graduates are actually female. Was your, I mean, in brief, just touch on it, was that kind of experience at uni, those sort of numbers?
Oh, I had an unusual one. Physiotherapy was predominantly women, except I think there are actually more men than women at the University of Melbourne in that first year. And when we graduated, it was a relatively small cohort, but I think it was more men than women, and it was quite a shift actually. Whereas, you know, physiotherapy and a lot of the allied health sciences, social work, occupational therapy, speech pathology, and the like, have always been dominated by women. But that wasn't my experience at university at all.
Interesting. How about the others?
Yeah, I was I mean, medicine historically was incredibly male dominated, but when I was going through, it was about 50-50. Certainly, once you start looking at getting into the specialty training programs, some are very heavily male oriented. Surgery still was predominantly male. But pathology, I think, is the converse. That's a lot more heavily weighted towards female trainees these days. But every cohort I went through, it was almost 50-50.
Interesting.
And for me, I took physics at uni, and that was predominantly male, but all my other subjects were sort of chemistry, biochemistry, microbiology, etc. And they were much more skewed to females. And I think in my biochemistry honours year, we were about 50-50. So I think it really depends on, you know, which flavour of science you're doing. I had a friend doing engineering, and I think she was one of only 2 women in the whole cohort back then.
It's interesting, isn't it? So I think we'll come back to about sort of your worlds of science and medicine and forensic science and health. For Belinda, is it interesting about that actually it is quite diverse, and in actual fact, if I look at the stats here at VIFM, we are highly represented with females in the sciences here. But it is interesting when you go back to uni and sharing some of your experience. Okay, so we're up to uni days. You've just recovered from reading trashy novels, Joe, going out partying, moving away from home, all that kind of stuff.
Studying. I was always going out studying. Yeah.
We believe you. Now, I suppose the next step is getting into the lab, and I know the lab will mean different things. We're just going to use that, you know, for all of us. Your first job. So we talk about. Okay, so you've been through that, you get your first job, and I know it's different in different areas, but talk to us about what your first working experience was and when you started practicing, and the environment that you came into. Share some details of those, and we can start with Beck, if you like, Beck.
Sure. So my first job, my first role in forensics was in the biology area of our forensic services department. And at that time, there were quite a few females at the practitioner level. So it was not unusual at all for me to be joining as a female. When I think back to what the department looked like back in those days, there were very few women in leadership positions and very few women in some of our more sort of traditional forensic services. So crime scene, I think there might have been just a couple of female practitioners operating in the crime scene area. I don't think we had any females at all in ballistics, for example. Fingerprints, probably starting to see more females coming through, particularly as we were on a civilianization path with our fingerprint cohort back then. So on a day-to-day basis, I started out in the DNA lab, very gender unbiased, very neutral at the practitioner level, but not at all in the leadership levels. I didn't feel that there was a barrier there, though, at all. Very, very fortunate across my career to have had male leaders who've been very supportive of striving toward good gender equality in the workforce. And I've often wondered why. And when I think back to those particular individuals, the one thing they all seem to have in common is that they were all fathers of daughters. And I wonder whether that on some level played out for them. But I never at any of the interviews that I went for along the journey, never felt that my gender was a barrier in terms of getting any of those sorts of opportunities. Probably my main memory of those early days of where I was very aware of being female and few in numbers was when I would be in the crime scene. So I mentioned earlier going to crime scenes often with David Ranson. I do have memories of being in the field at crime scenes where I was the only living female present, and the only other female present was sadly the deceased individual. And that's quite a shocking environment to find yourself in. And all I can remember from those days was the absolute professionalism and respect that the men around me showed to that deceased individual. So this is the men of the crime scene examiners that I was out with, and members of the homicide squad. It was always professionalism and respect to the deceased individual, and certainly to me as well, in terms of creating an environment where I was valued for my expertise. I never felt that I had to push my way in there or justify my presence. It was a sort of an encouraging work environment from that perspective. What I will say is my experience is not the experience of everybody in my department, and there will be members of the team out at forensics who will have had a different experience. I'm quite sure about that. And certainly in some of our work groups where we've had very few women traditionally, that they may have had a different experience to the experience that I have. So I don't mean to Pollyanna about it and gloss over it, but my experience was always very positive in that regard.
No, that's great. And I think it's great that you clarified that it might not be the experience for everyone, but glad you had good experience. If we, just a simple one, what was your first job title, Beck? Do you remember?
Well, forensic officer was my classification, and it was a forensic analyst in the DNA analysis section. Amazing.
Forensic officer. Thank you. Belinda, what was your first working experience? First job?
I think my first year out of uni was a pretty wild year. I worked about 5 or 6 jobs, actually. I worked full-time in inpatient rehabilitation. I worked sessions at a sports medicine clinic. I worked with a football club. I taught hydrotherapy in the evenings. I provided first aid services for a netball centre, and I worked the weekend and public holiday roster at the Royal Children's Hospital. So I pretty much lived in my car. I spent a lot of time driving. I actually changed my clothes in my car most of the time, going from one job to another, which is unsettling. But really, I transitioned pretty much exclusively to working in sports medicine and predominantly in Australian football. So probably 90% of my clientele were footballers, 17 to 35-year-old men. I was in an environment where I was often the only woman present. And it was a really interesting environment. I mean, I was aware of my gender from there were most of the men were really respectful, but there were those that just weren't, and they never will be. And you could call them out, but their behaviour never changed. It was quite challenging. But from the perspective of career progression, the entire time I worked in sports medicine, there was not one moment of my time in sports medicine where I actually thought my gender was going to be a problem from career progression. And it was only in the transition to academia that, and very quickly after the transition to academia, that I was in a seminar which was a preparation for a mentoring program for women in academia, and I was very newly minted out of my PhD. And they put up the statistics, and I had a very big uh-oh moment. It was the first time pretty much in my life where I felt my gender was going to be a problem. And it was quite striking at that stage, the proportion of women professors was extremely low, about 12 or 13%, I think, across the university. And their target was 20%. And when I put up my hand to ask why wasn't the target equity, they told me, and I'll never ever forget this, it needs to be achievable. So it was quite this, I mean, this is 20 something years ago. This is before, you know, dedicated, you know, gender equity programs, before the development of the Athena Swan programs and the like. But yeah, I had a massive an moment that really shook me, quite shook. It was quite upsetting, actually.
Incredible, these experiences. Jo, how was your first role? What was your first role? I think you touched on it.
Yeah, you can look at it from different ways. I mean, first role out of medical school as a junior doctor at the hospital. I was actually very lucky with the supervisor or the consultants, the specialists I had. They were very supportive. They were all male. And I was still at that stage, it never really occurred to me that things would be different if I was male or female, because there were so many both, you know, male and female around. And the male surgeons in particular were very supportive, getting me my own little operating lists. One helped mentor me into getting onto the College of Surgeons and sitting exams. And that followed me through my career, that I noticed that there were a lot of strong male role models. And I agree that the ones with daughters in particular, I think really that they didn't care what gender you were, as long as you worked hard and did a good job. That's what they respected. It was the quality. But it was then that I really did start noticing that there were differences in medicine in the way often patients treated you. I was very often mistaken for being one of the nurses. And now that's not saying it's not meant to downplay the role of the nurses, because the nurses absolutely keep the hospitals going, but they're different jobs. And I remember one guy, I had seen him in the emergency department, diagnosed him with appendicitis, removed his appendix at surgery, and then discharged him some days later. And he said, "Oh, thank you, nurse, but it's amazing we don't have to see doctors anymore." So that became a factor as we were going through, and we had one surgical team where the two consultants were female, the two registrars were female, and our two junior doctors were both male, and the patients would turn to them for advice and listen to what they said over us, until one day we had suit day, where we all dressed up in suits, you know, real power dressing, and all of a sudden people began to take us seriously. So it was then I really started to notice the difference. But then into forensic pathology, my first job, I was the very first forensic pathology fellow in Auckland, and the head of forensic pathology there, again a male, was absolutely instrumental in being a role model, but also getting that job created for me. I mean, partly I think he just got sick of me pestering him. I would go in every Saturday morning, even when I wasn't working in the forensic department. I would say, "Can I come in every Saturday morning?" As you know, that's normal. You go in and watch autopsies on a weekend. I'm sure everybody does that, but just to convince him that I wanted to learn and wanted to do it. I went to a crime scene with him on New Year's Day and wasn't able to attend the subsequent autopsy. And because I'd arranged to have high tea with my mum because it was New Year's Day. I wasn't working there, wasn't paid or anything. And he's never let me forget that I never turned up for that. But he created that job for me. And then I was the fellow in that department. I was the only woman in that department. It was very male dominated, but that, amongst peers, that's never been an issue. It's never really, you don't get treated any differently based on gender. But then when I began to interface with the police, not Victoria Police, but with police, and go to crime scenes, I mean, I remember turning up to a crime scene and the scene guard, one of the uniform officers, rushing up to me and saying, Miss, you can't be here. This is a crime scene. Miss, you have to leave. Only to be devastated to learn I was the on-call forensic pathologist and had been asked to attend. I've been mistaken for the tea lady amongst my male colleagues by a curmudgeonly old forensic dentist who came in, and we were all introducing, and he was catching up with the men, and then looked at me and said, milk, no sugar. To which, to be fair, my male colleagues immediately jumped to my defence. And in the early days, I noticed it in court, that you would often get treated in a way that was different to the my male colleagues, where your qualifications would be questioned because you appeared young, or if you were a young female, you were more likely to be questioned or called Miss instead of your titles being used. And you'd get the, lowering of the glasses, sort of, remind me, Miss, how long have you been doing this? And you'd get a lot more questioning of your expertise, which when discussed with my male colleagues, they said, I've never had that. They just ask us the questions about the pathology. Now I've clearly reached an age where I have enough grey hair or wrinkles, or I've just been around long enough, I don't get that so much. So there definitely is an age aspect to that. And I know I've had colleagues of Asian descent, often who I think luckily look younger than their age. And I know when I get older, I will be wishing I had genes like that, where you can look so beautifully young, but they get questioned as well because they look younger, male and female. But before that, it had never occurred to me to be treated differently because I was a woman. So yeah, it has its ups and downs, but I can absolutely say I've had some fantastic male role models and advocates without which I wouldn't be here today.
I'm getting a sense of that theme actually, but it's interesting coming out of the highs of studying and progressing, and then almost being hit with some reality checks, albeit it's not all like that, but there are definitely some. If we take that then, so you've got your experiences, both good and bad, and that sounds to me like the good outweigh the bad, but some of those stories are too scary when you hear them firsthand, right, about what somebody might have to go through. But as you took your first forays into leadership yourself, when you started either directly being responsible and managing people, and I know that can be different because you do different things. It might be you virtually leading teams and departments as a more senior doctor, for example. But did you take some lessons, and did it make you behave in certain ways, behave differently, think about that as you got into, your first manager role, your early, or that early stages of management? And maybe if you share that. So the question is, did you take some of that, and did it make you, behave in a different way yourselves in your first days of management? And tell us what that role was when you came to your first leadership position. That would be great. I don't mind. But Belinda, would you like to kick off?
Yeah, I think really, I mean, Joe and I think Beck has really brought it through, is mentors are so important. I really cannot, I will not be here today at the level I am and doing what I'm doing without having, outstanding mentors. And I've had both male and female mentors, like the other women on this webinar today. I think that's been really critical, and getting those early, and they change over time. There's no question as you progress through. I had the unusual experience of being a leader at quite a young age. So most of for example, my PhD students and my staff were actually older than me, yet I was their supervisor. And I remember distinctly, I had this fantastic research nurse who worked with me, and she had worked at Alfred Health, I think, for decades. And we were at this very fancy do, everyone all dressed up to the nines. And anyway, there was a very senior person from the health service, and they recognized her, and I was with her, and they said to her, and they said to me, oh, so do you work for Anne? And I remember her saying, oh, no, darling, I work for her. And it was just, one of those moments where, she was really sort of, putting them in their place and just letting them know, actually, no, women can do things that, and I think that's been, that for me was quite challenging, because most of my staff and my students were older than me, and it took, it is a little isolating as a manager, I think, as a supervisor, as a manager, as a leader. I think it can be a little bit isolating because you are really, you really have to approach things in a different way. But I came through the School of Public Health when there was a real influx of fantastic women leaders who were really motivating. When I started with the school, there were very few, very, very few female professors, and watching the recruitment and the change over 2 decades has just been, awe-inspiring, really. And we have a collective of women leaders now that we all learn from each other, we share our experiences, we create an environment. We're very dedicated to creating an environment where we will bring our our women future leaders through without having to go through a lot of the nonsense that we went through along the way. And I think that cultural shift, that cultural change has just been one of the most rewarding parts of working. But yeah, it was a bit rocky at the beginning, but stronger for it. And through mentors and through incredible peers, it really is, making those connections, forging those connections and relationships is really what sort of, is really what really, made the experience so wonderful, I think.
Amazing. Thanks, Belinda. Anything you can relate to there, Beck?
Yeah, look, I think for me, my early leadership roles, because as I've said, I'd had a pretty good experience. Gender hadn't really shown up for me as a limiting factor in my early stages of career. So I think when I first came into leadership, I probably was a bit complacent, to be honest, about the whole gender issue. But I think the moment for me where my eyes became really open to the issue was when I came back into the workforce after having had my first child. And I suddenly realized, gosh, there's very few women around me or above me who are mums. And that made me start to think about career trajectories and how we seem to be pretty good at creating an even playing field in the early years, but there seems to be something happening when women make that decision to go off and have babies. We traditionally haven't been great at bringing them back into leadership roles. Now, just because you can doesn't mean you should. It's not everybody's choice in life, but that's one of the things that I've become really focused on since coming back into the workforce, making sure that it's, we're not just thinking about raw numbers, men, women, we're thinking about people with caring responsibilities, men and women. Are we creating opportunities and pathways for people who have got other responsibilities outside of work? And I'm really pleased to say that at the moment in my department, so we're a department of 500-ish, my strategic leadership team, we are 5 from 7 women. If you look down to the group manager, the mid-manager level, we are about 50% men and women. And at the unit leader level, which is our real frontline leadership, one of the most important roles, I think, in our department, because they are the front line of leadership that interface with our practitioners on a daily basis. We're also around 50% there, men, women. So we've got a good pipeline, and we've got some good things on the numbers, but there's a story that sits underneath that around motherhood, fatherhood, caring responsibilities that I'm still very focused on and still very keen to unpack, and conscious of not letting complacency fall in because we look good on the numbers. I'm not sure if that really answered your question, but that's what came into my mind.
And unfortunately for Jo, it's led me down a path which I'm going to ask Jo a question on. So one of the studies that the UN did also was about the fact that we're losing female scientists in that middle stage of their career. And I think you just alluded to some of in your early insights about being a first-time mum and looking around and other people weren't there. That may be one of the things, it may not be. But Jo, have you seen that? Are we losing female scientists in that mid section of their careers?
Look, I think at VIFM, in pathology at least, not so much. It's, we're really well supported here, where people can take maternity leave and return to the workforce. I don't have children myself, and part of that has been around career. It never really yielded that opportunity to do so. But I agree with that, not creating complacency. You don't want to rest on your laurels. And I think it's about, for me as a leader, it's about not just, as Beck said, not just facilitating childcare for parental issues, be that maternal or paternal care for their children, but it's about those caring responsibilities. And my staff are diverse. We have people that have a wide range of caring responsibilities. So it is about making that able to happen, but just about creating an environment that allows flexibility. So that can help in terms of people coming back to the workforce, that it doesn't have to be Monday to Friday, 9 to 5. You have to turn up at the office and you have to be here. It's around creating that flexibility so that people can be here in a way that suits them. Because I think traditionally that would discourage people from coming back. You don't necessarily want to be doing the Monday to Friday, the commute, which may add on significant travel time for some people. So one positive that did come out of the pandemic was the flexible work arrangements and the ability to do things like this online, to learn online, to attend meetings online. But I think for many, as Beck said, just because people can come back doesn't mean they necessarily want to. Some people want to have that early stage career and then realise that being a mum or being a dad or having caring responsibilities is actually what they want to do. And that's fine as well. So it's about supporting their choices around that, so that if people want to make a decision, it's a decision that they're making because it's right for them, not because there are barriers in the way. So really it's about, as an organisation, enabling people to do what they want and make the choice that's right for them and support that. And I don't think historically that's always been present, and I hope that is better now.
Good. I think we all would, and I hope all three of you are seeing it in your organisations. Really do. So we've come through. It's like a therapy session for you three. We've come through, the early days, early career. You've been sharing all these experiences, and now we are here today. And you'll be shy about beating your own drums and self-promoting, no doubt, but share with us perhaps your roles now. I mean, they are, and for example, Becca's told us 500 people. It's, the biggest forensic services department, incredible. But also, so talk about your role now, what it is you're responsible for, both people-wise and the kind of work output. And we may circle back to it, or feel free to. I'm really, as leaders now, what are you most proud of, like personally, like a work thing, right? Like something you've done in the field of science. That would be awesome. So tell everyone what you're doing now, the kind of responsibilities you have, and some of the incredible things you personally have done and feel proud of. Who'd like to go first?
I'm happy to start. So my role now is as the senior executive running the Forensic Services Department for Victoria Police. It's an operational arm of Victoria Police. We do have that 24/7 service delivery response. So for me, it's really the standard sort of responsibilities of an executive. It's operations, it's strategy, it's risk, it's finance, it's people and culture. It's all of those sorts of things. Sometimes I say to myself, I could be running a sausage factory. It would be the same considerations, but luckily for me, I'm not. I get to run this incredible department with these amazing members of staff who are just so passionate and knowledgeable about their science, and I just love it. I just absolutely love it every day. And I think you're very lucky if you find yourself with responsibility to run something, an area that you feel incredibly passionate about yourself, and that you've had your career in. So thank goodness I don't have to run a sausage factory. In terms of the day-to-day, it's a lot of sitting with my team. I have a phenomenal team of leaders around me at the department, and we work really, really closely together. Again, a lot of operational focus, but we also have a research and innovation group. We have a business services area, and we've got a data analytics team. So there's lots of really interesting work that we're doing, not just to deliver services for now, but to position ourselves best for the future. And probably that's where I'm my happiest, when I'm at the whiteboard with one of the teams, or I'm popping into one of our work areas, our fingerprint group, our biology group, our drugs group. These people are continually innovating, looking for ways to manage demand, because demand exceeds capacity, and we have all the struggles of a large lab that is sitting in that space, backlogs, turnaround times. But our people are continuously innovating, finding better ways to do their work. So improved science. We have a very active Office of the Chief Forensic Scientist under my colleague, Dr. Kay Ballantyne, who leads a whole load of work around how to get best use out of our science, how to report in a transparent way to safeguard against miscarriage of justice. Her and her team, working closely with practitioners across our operational limb, have done a lot of work around error rate. And one of the things I think I'm most proud of is that we are world leading in our approach to transparent reporting in the court environment. So that's the kind of stuff that keeps me really excited and really energized. My Director of Forensic Operations, Kate Quinn, again, is always working with her direct reports to innovate in the way we deliver our services to better manage our demand. So I love that aspect of my role. I also sit on Victoria Police Command, so I have another role within the broader organisation, and there it's a lot of work around holistic enterprise level strategy and risk. And I have other roles as well, like sitting on the Honours and Awards Committee, sitting on the procurement board. So it's a really busy role. The other aspect to my role is chairing ANSFEC, which is the Australian New Zealand Forensic Executive Committee. And that's a committee of me and my counterparts from around the country and New Zealand. So I really enjoy that element of my role. And at the moment, I'm the elected representative for Australia and New Zealand on the International Forensic Strategic Alliance, which is a network of forensic science networks globally. And our role is really working around improving standards, improving the knowledge that underpins the work that we do, and creating connections so that we can work together for the greater good. So I really enjoy those aspects of my role that take me beyond, my office, and into sort of that work around strengthening the sector, I guess, to deal with whatever challenges might be coming down the path.
Incredible. The more I'm only 8 months, maybe a little bit longer into the world of forensics. The amount of acronyms, you just added about 3 to my list that I'll need to keep on top of. Incredible. It just listening to that. Thanks for sharing. Amazing. Joe, do you want to go next?
Yeah, so I'm head of forensic pathology services here, so I'm really lucky to oversee a very diverse range of people. There's about 17 pathologists here at VIFM, but overall I have about 30 direct reports and maybe 50 to 60 indirect reports. But in terms of the things that I'm proud of, it's both big scale and small scale. The big scale thing is I love being surrounded by teams of smart, motivated individuals. And now in my role, it's really satisfying to be able to help create an environment that encourages that and facilitates that and enables them to do the best job that they can. These are not people who need day-to-day management. They love their jobs. They love coming in and doing it. And it's about trying to enable them to do that with as little fuss as possible and with as most support as possible. And I love the passion that the team has. but I still love the small scale stuff. I still enjoy being a forensic pathologist. I still enjoy the fact it's a really humbling job that we're the deceased's last doctor. We get that ability to examine someone who's died, to provide answers to their loved ones. You'll be the first person to know what this person went through in their last moments, to understand what went wrong that resulted in their death, to find things that might be really important for their families, or for someone who's died perhaps a violent death at the hands of someone else, to be able to tell their story from what the injuries tell you. That can take its toll sometimes, but again, I refer back to that great team. Everyone supports each other, and that's what I love. That's a success and a highlight of the job, that we have a team, particularly amongst the forensic pathologists and our forensic technical officers, where we're self-supporting. Everyone supports the other person. They know when they've had a rough day, and it's those little human touches in the team. I mean, VIFM is a centre of international expertise. We can list awards and qualifications and these high level things, but actually it's that little day-to-day human touch amongst practitioners that you'll see. You see it amongst the police, you'll see it amongst people who deal with crime and trauma, that it's those little human touches are what make it worthwhile at the end of the day.
Amazing. Beautifully said, both of you. How about you, Belinda?
Oh God, that's really hard to follow. I lead a research unit in pre-hospital emergency and trauma. I have over 40 research professional, academic, and higher degree by research students as part of my team. I am blessed with a very interdisciplinary team, which is an absolutely wonderful environment to work in. I love watching every single day, watching all of these disciplines work together in a very flat structure. And the reason is the flat structure is because nobody gets research done unless it's done as a team and everybody does their job. And what I really, really enjoy about it is just the incredible minds that I work with every day, that are unbelievably smart, challenge the status quo, find new ways to do things. And my job often is just to get out of their way.
Nice.
Simply just to pave the way, is just to clear the path for them to do what they do best. And I actually really, really enjoy that part of the role. And we've had some, we've really, over the last 20 years, had some really major wins in the world. We've, shifted the global focus on trauma outcomes from whether a person survives or doesn't to how well they survive. Preventable mortality is extremely low. And the big blind spot in trauma care was really how well people actually recovered from their injuries. So we've led the largest, studies around the world that have looked at long-term outcomes of trauma patients. We've done the largest qualitative studies of patient experiences. We're running world-first clinical trials of trauma patient navigators to try and improve the experience for patients. And I think what I'm part of what's really exciting is that the patient is at the centre of all of the work that we're doing, and our job is just to facilitate those better outcomes in the best way that we can with the data that we have, and working with government, working with industry, working with consumer organisations, clinicians. It's an absolute pleasure every day, and watching my PhD students, my research fellows, watching them progress through their careers and go on to be independent researchers running complete research programs of their own. Recently I had, my deputy head of unit, is absolutely just doing amazing work in the sustainable mobility space. And, he's really ready to run his own research unit and to break away. And he's genuinely worried about asking me about that, but I can't see anything better. I mean, I've done my job. If he breaks away and runs his own research unit and goes on to to an amazing career, that's my job done as far as I'm concerned. So.
Well, Belinda, you asked, could you follow? And you more than did that. Particularly loved a bit about just getting out of the way. an awesome sort of tip for leadership, I think, a lot of the times, from what I've heard, from your experience. Awesome. Now, thank you. We're right about smack on time, which is awesome, because there's a really interesting question that's popped up in the Q&A. It's something I've heard of before, and tell me if you have. But Olivia says, thanks for sharing your experiences in your first career jobs. And I like this because you all sound incredibly busy. So tell us a bit about how you manage your workload, and in particular, how to say no. This is something, said Olivia, I feel like I find much harder than my male counterparts do as an early career scientist. What do you feel? You agree with that?
Yes.
Yep.
And I think there's a wide body of research that shows this, that women do, that women in leadership take the invisible roles, the caring roles, the nurturing roles, the supporting roles, that don't count on their metrics. It's not an output, it's not a publication, it's not a grant, and they're under recognized for the roles that they take on, but they're also extremely good at them. On top of those things. So there is a real, there is that real challenge and that push and pull between things that that you can actually take on and you would actually do very well, against sort of protecting yourself and protecting your time and making sure that you really get work-life balance right. And it's the biggest question that comes up in the people that I I mentor, is really how do they find that? How do you say no? And really, one of the biggest ways I encourage people to do that is to plan out their time, and actually plan out their time for the separation from work, for the time away from work, and can you fit it in? And it's really a prioritization, and sometimes that's difficult to do on your own. And having a really strong mentor, a really great influence to sort of help you work through those questions when they arise become really important as well. So if you can't say no and you're worried about saying no, then having the opportunity to talk it through with someone and help you, sort of respond to that. And I think once you've said no once, it's easier to say no after that. It's the first time you say no, you say it and you apologize. I'm so sorry, I can't, because of here are 65 reasons why I can't do it. But in reality, no man does that. They just say, no, I'm not doing that at this point. So I think once you've said no once and realize that that is your right to do that, what your workload is, what your priorities are, then it becomes easier to say no after that. But even now, I still find myself apologizing when I say no. So it's a habit I'm trying to get out of, but it is definitely something that women do.
Right.
I absolutely agree with Belinda. It's because I got advice at the start of my career to say yes to everything, and that was great because you got great opportunities. But then the problem is you said yes to everything, and it's taken a long time to realize that if you say no, the world doesn't end. It carries on, and people don't hate you for it.
No.
And people don't, all the catastrophizing you do where you think no one will ever ask me again, they'll hate me, they'll think I'm lazy, they'll think I'm that. They don't. They actually don't. They say, okay, that person can't do it. I will find someone else, because if one thing dealing with death has taught me is that bad things can happen to people, and no one is irreplaceable. And that's a very humbling position. And as soon as you realize that no one's irreplaceable, you're very humbled by it, and you say, this would carry on if I'm not here. So I can say no, and I don't. And look, this is easy for me to say, and I don't always do it, but to have that time where you say, I'm switching off this weekend and my time is my time, and I'm not going to feel guilty about that, and I'm not going to apologize, because the apologizing then makes you feel bad for apologizing, because you realize you're apologizing, and then you feel bad if you don't apologize, and it just becomes an absolute spiral. And it's easier just to do it with kindness. And I think women do that well. We can say thanks, but no.
Yeah, well said, both of you. I completely agree. I was listening to a leading podcast recently, and I can't remember who it was, but it stayed with me. They said, it's a sort of, there's a time and a place. So in the early stage of your career, actually, it's good to say yes to everything because it helps shape you. These different and varied experiences helps you get a sense of what you're good at, what you enjoy, what you don't quite so much enjoy. And it can be really beneficial in terms of helping you make decisions about where you want to go to next. But once you get to sort of mid-stage and beyond in your career, it's actually much more important to say no because you spread yourself too thin otherwise. And so I think for me, it is something that I find really difficult to do, but I'm being much more mindful now with my times, particularly since I'm in my 50s now. You don't perhaps have the energy that you used to have, and the stakes are sometimes higher in the things that you're having to deliver on. So you really do need to make sure that you're showing up match fit for those big challenges that you're dealing with. So I actually have a post-it note with the word boundaries written on it on my desk at home, and I look at it periodically. I think the pull for me is the people who are asking me for help are my incredible team who are also incredibly burdened and working very, very hard. So I hate to say no to them. So I think it is about being selective, saying no to the things that aren't in line with what your priorities are for that particular, time frame, and the key things that you're dealing with at that particular time, and just practicing it in front of the mirror, just practicing no, saying the word no. It sounds ridiculous, but sometimes just getting it out and that could be helpful. But it is absolutely something that I think we all struggle with.
And I think that it's about managing expectations as well. So, managing people's expectations of you, but also I often use the opportunity when people have asked me to do something to actually use that to promote someone else to do it. So it might be to give that opportunity to one of my research fellows or PhD students or others to get involved. There are other ways that you can do it. You might know someone, that you can tap on the shoulder who would actually, take on that role or take on that responsibility very well. And so using the opportunity to bring others through and to give them that experience. In a lot of the requests that come to me, I'm doing more and more of that over time.
Thank you. I actually think it's a beautiful way to finish where you've gone through this incredible journey with us, and thanks so much, and then actually come out of the side and said, and here's some tips to help. Thanks, Olivia, for the question. That is a wrap. Just before I thank the speakers, there is a link that Fiona's put in the chat for a feedback form. That will really help us at the VIFM check future events. Thank you. Thank you to everybody who's attended online. We really appreciate it. We hope you enjoyed it. You'll get an email from us in the next couple of days. We will publish the recording of this should you wish to go back and share, and we'll continue to promote a healthy and diverse forensic science and health science sector within Victoria and beyond. I think for all four of us, we will take pride and delight in doing that. With much sincerity, thank you. You are three of the most busiest female leaders in Victoria and the three most accomplished. It's been an absolute pleasure to hear from you, and your storytelling and your experiences have been spot on. On behalf of people who can't talk back in the audience, thank you very much, Professor Belinda Gabbe, Dr. Rebecca Kogios, and Associate Professor Joanna. I've never called you Joanna before, that threw me then. Glengarry, Glengarry. Thank you so much, speakers, and to everyone at home. I hope you enjoyed it, and we'll see you again at one of our events soon. Thank you.
Thank you very much.
Thank you.